Tonight is the doctor's edition. I'm Dr. Rita McGuire. This is just a great picture slide of our medical advisory board. So we have other practitioners that are advocates for utilizing CBD in their practice. And so we're going to talk about tonight CBD and its effects on glaucoma. I'm the Chief Medical Officer here at Wakana and one of the co-founders. And welcome to the Doctor's Edition. I'm an obstetrician gynecologist. I graduated from Wayne State School of Medicine, did my residency right here in Cook County. I'm CEO of RJM Wellness and Rip3 Fitness. I'm really adamant about women and women's health, obviously. I'm a certifying physician for the medical marijuana program here in Chicago, or in Illinois, excuse me. I absolutely am an advocate for both parts of the plant. And I am a member of Doctors for Cannabis Regulation. And again, like I said, I'm one of the co-founders here at Wakana and Chief Medical Officer. I'm a practicing physician.
I don't know if you're up or want to do anything. Oops, I'm sorry. Sorry, Dr. Rita.
Still a practicing physician, still continuing to do C-sections, hysterectomies, liposuctions, delivering those babies. But I was very fortunate to testify for the Judiciary Committee for the legalization and taxation for the adult use cannabis program here in Illinois. So let's talk about glaucoma tonight, and let's talk about CBD, and let's really learn about how this amazing plant can be utilized in such a condition like glaucoma. So what is glaucoma? So glaucoma is a condition that causes damage to your eye's optic nerve. It can get worse over time. It's linked also to a buildup of pressure inside of your eye. Glaucoma can be inherited. It may not show up until later in life. In primary glaucoma, the causes are largely unknown. In secondary glaucoma, typically it's related to other conditions like diabetes, inflammation, cataracts, or even a tumor. So you can see here in the normal vision, you have a normal pressure of aqueous fluid here, but on the very far right, when you have a buildup of this aqueous fluid, it causes pressure on this optic nerve. So when we talk about the development of glaucoma, it is again the pressure of the fluid that's not able to be transported. It's a backup, and when that fluid has an inability to move, it causes pressure on the optic nerve. So it's
Dr.
called—
Rita?
Yes?
Sorry, I'm not seeing your slides. I don't think it's me.
Oh, okay, let's see. Let's try to share that.
There we go. Now I see it.
Thank you so much.
You're welcome.
We're having all sorts of technical difficulties here. So where were we? We were on the development of glaucoma. Tonight we're talking about glaucoma and CBD. So in the healthy eye, we have a normal amount of fluid, clear fluid called aqueous humor that can circulate to nourish the eye. And you can see that fluid is able to absolutely circulate very easily. In glaucoma, there's a blockage where that fluid is not able to circulate. So what happens, you get a lot of pressure on the eye and on the optic nerve. So that is called intraocular pressure that builds up. It could cause a lot of harm to the optic nerve. So when we talk about risk factors for glaucoma, you know, having high intraocular pressure is a risk factor. Being of a certain ethnicity, African, Hispanic, and Asian heritage. Anyone over the age of 60 is at more risk of developing glaucoma, especially in the Mexican American population. If you have a family history of glaucoma, if you have systemic diseases like diabetes, high blood pressure, migraines, poor circulation, and even heart problems. If there's been steroid use, also those who are at risk for glaucoma are those who have farsightedness, or nearsightedness, any of those conditions. Now, glaucoma is diagnosed by an optometrist or an ophthalmologist. Then eye exam is done. It's really important that you have regular eye exams. You should get a baseline eye exam at the age of 40. You may have that done earlier if you have high blood pressure, if you have diabetes, and if you have any of those other risk factors that we talked about. We have these really high-tech equipment that can measure the pressure in the eye, and we also do peripheral vision checks as well. So most people with glaucoma really have no early symptoms or pain. That's why it's important, if you have risk factors, that you get an early eye exam, you see your eye doctor on a regular basis, and absolutely every 1 to 2 years, you should be getting a complete eye exam. According to the Glaucoma Research Foundation, I mean, this is a problem. It's estimated that 3 million Americans suffer from glaucoma. Half of those who have this eye condition are unaware of their issue. Glaucoma is the leading cause of blindness in the United States. In fact, 10% of people with the condition experience loss of vision, even with proper treatment. In the US alone, glaucoma accounts for up to 12% of all cases of blindness. In fact, the African American community is up to 8 times more likely to become blind from glaucoma than Caucasians. And what is really very, very alarming is that in 2002, Prevent Blindness did a survey, and they found that 30% of Americans have never even heard of glaucoma. Hopefully this survey has been updated and more people have been able to understand and know what glaucoma is. But 50% of those people in 2002 that were surveyed had heard of the condition, but they were unaware of really what it was. So when we look at the optic nerve, this is a nerve here that's very, very, very important. In fact, it's responsible for carrying images to our brain. It contains more than 1 million nerve fibers. It makes up part of the retina that gives us sight. And the nerve fiber layer can be damaged. It can be damaged from pressure when it becomes too high. It can be damaged to inflammatory conditions. And over time, this constant chronic high pressure that the nerve undergoes results in decreased vision and even blindness if it's left untreated. Glaucoma is also known as the silent thief of sight. Glaucoma is an eye disease, again, that involves an increase in pressure. This increase in pressure, as you see here, causes increased pressure on the optic nerve, and it damages the nerve. It can cause permanent vision loss. So without treatment, glaucoma can cause total and permanent blindness within a few years. So it can be very fast. Treatment for glaucoma, the most common treatment for glaucoma is we have prescription eye drops. And their whole role is to reduce the pressure in the eye that prevents damage to the optic nerve. There's all sorts of different classes of eye drops. There's some eye drops that really concentrate on the blood flow and improving blood flow. There's some that reduces the pressure and some reduces the inflammation, and all together. we see that there are different severity levels. You know, when you see glaucoma early, there's a greater chance in preventing further eye damage and vision loss. When we see those who have end-stage glaucoma or refractory glaucoma, you know, the risk of blindness is very increased. So there's medications which we try to use first. There's laser therapy, there's coagulation or cryotherapy. As you have an increase in severity in glaucoma, as you can see, you have to be more aggressive and more invasive procedures need to be done. So pretty much, you know, keep in mind that glaucoma is one of the leading causes of preventable blindness globally. Aging increases the risk of developing glaucoma. Early detection is really, really important. You may not have any signs or symptoms. That's why if you have risk factors, if you have comorbidities, if you have a family history, you know, it's important to get those regular eye exams. Regular checkups is necessary for early detection. Again, if it's left untreated, it can cause blindness. Vision loss can be irreversible. No cure is available. We do have treatments, starting with those eye drops. So now let's move on to what you really want to know, and that's how cannabis can be used in a condition like glaucoma to assist with some of the symptoms that glaucoma can cause. So when we look at the cannabis plant, it's important to know that there's two species. In fact, many of us know about the marijuana species, right? That's the part of the plant that gives us the high, the euphoria, the paranoia, and even the munchies. It has high levels of delta-9 THC. That's the reason why marijuana gives you the high. And the other main components or cannabinoids in marijuana is called CBD or cannabidiol. Now, on the other part of the species or plant is called the hemp species. That is a species that gives you the health without the high. You may ask, Dr. Rita, why do you say that hemp gives you the health without the high? Well, it's because hemp, by definition, contains very small amounts of THC, 0.3% or less of delta-9 THC, and higher levels of CBD or cannabidiol. This is why hemp is very, very mainstream. It's really very popular these days. You'll see a lot of products in the gas station and health food stores and grocery stores that are hemp-derived CBD products, because people do want that holistic way of addressing their health, but they don't want to be high. And so they're really turning to CBD. There are a large number of studies that have shown that cannabis to be a viable and highly effective treatment option for glaucoma. In fact, we know that Robert Randall, he was diagnosed with glaucoma as a young man, and a federal district court ruled 25 years or more ago that Mr. Randall's use of marijuana for his glaucoma was medically necessary. 2 years later, what happened? The government, and this happened in the 70s, the government came back and cut off his access to his medication, which was cannabis. But he sued and he won, and he was later reinstated to use cannabis. Robert Randall unfortunately passed away in 2010, I believe, from HIV/AIDS, but lived a very productive life and did not go blind because of his cannabis use. So cannabis and cannabinoids like CBD have been studied. You know, there have been research, obviously in the 70s with Robert Randall, to show that it is able to reduce the intraocular pressure. And it's also neuroprotective, meaning that cannabis has been shown to improve the nerve fibers that have been damaged by the increase in intraocular pressure. In 1971, there was a study that found that those who ingested cannabis had lower intraocular pressures by 25 to 30%. And that these patients that they studied who were using cannabis or ingested cannabis every 3 to 4 hours achieved a consistently lower intraocular pressure. And that's why we talk about when using CBD products, it's important to have that constant, steady level in the bloodstream. So CBD has also been proved to be practical and an effective option for the treatment of glaucoma. And what's so great about CBD being an option is that in 2018, hemp was removed from being a Schedule I drug. Now hemp is legally a product you can use, you can sell it, you can consume it, you can cultivate it under the 2018 Farm Bill. So the 2018 Farm Bill, though it's an agricultural bill, it did remove hemp from being a Schedule I drug. It is now legal to use. So when we look at CBD, it really has a lot of benefits as it relates to improving symptoms of glaucoma. We can't say that CBD cures glaucoma. We already talked about that there's no cure, but because CBD has anti-inflammatory properties, because CBD has antioxidative properties, because CBD is a vasorelaxant, meaning it improves blood flow, and because CBD is an analgesic, it really does help those who have glaucoma. They may have pain and inflammation. Well, CBD is addressing that. Well, there's other cannabinoids too that the plant makes. In fact, the plant makes over 140 cannabinoids to date. And these cannabinoids synergistically work with CBD to help to reduce inflammation, help to reduce pain. These other cannabinoids you can see here are CBG and CBC and delta-8 THC. All of these cannabinoids made also by the hemp species is very, very instrumental on a cellular level in reducing inflammation, reducing pressure in the eye, reducing pain as well. So the cannabinoids, the plant, has a very physiological, scientific role in reducing inflammation, in being very effective as a tool, as I call it, in the toolbox for those who are using CBD to address symptoms from glaucoma. You know, it's called the endocannabinoid system. This is a very important system that many of you may have never even heard of, right? The endocannabinoid system was discovered in the early 1990s. And this discovery explains why when you consume cannabis byproducts, when you consume CBD, that it works in the body. So it's a physiological system. It is made up of receptors that are found throughout the entire body that help to regulate major physiological processes that we see. So these receptor sites, CB1 and CB2, are found in many organs and glands, found in the brain, the eyes. We're talking about the eyes today, the teeth, the skin, the lungs, the heart, the kidneys, the liver, the stomach, the colon, the bowels, the pancreas, the spleen, the immune system, even the reproductive organs, the muscles and bones. These receptor sites, when they bind with cannabis, when they bind with CBD, when they bind with THC, when they bind with any of those cannabinoids, they send a signal to put the body back in balance. And the body being put back in balance could be a reduction in inflammation, a reduction in inflammatory processes that cause pain, a reduction in anxiety. There are many physiological systems that are working when the endocannabinoid system and the receptor sites bind with cannabis. So this is how CBD specifically works when we're talking about the eye. CB1 receptors are very, very instrumental in reducing intraocular pressure to help regulate the outflow and inflow of that aqueous humor fluid that we talked about. CB1 receptors in the eye are also neuroprotective. So CBD's neuroprotective action reduces the damage that's been done to those nerve fibers, be it through inflammation or be it through the pressure of the fluid on the optic nerve. The CB1 receptors in the eye are also important in analgesic, meaning it helps to reduce pain. You know, many of these patients have, if they have closed angle glaucoma, they have debilitating stabbing pain in their eyes. So CBD helps to reduce that pain. CB1 receptors in the eye are also anti-inflammatory. We know that the inflammation around the optic nerve is a result of that chronic pressure on the nerve, and so it reduces the inflammation as well. So you can see that the science is there, and it works again through the endocannabinoid system. So these are some other studies that I wanted to talk about tonight. One study that was done in 1979, it was published in the International Journal of Pharmacology and Biopharmacology. And what they did is they analyzed 16 patients and its effect with CBD that had open angle glaucoma. And what they found is that after these patients took CBD, they experienced a reduction in blood pressure, which resulted in a decrease in the intraocular pressure. So it was observed that the effects of CBD lasted longer in patients with hypertension, and there is ongoing research in hoping to create a CBD eye drop for glaucoma specifically. So the other thing that we want to talk about is the amount of CBD. This is a study that showed that too much CBD can actually increase the intraocular pressure. We absolutely don't want to do that. So a study in 2006 by Tomita and other authors found that a CB dose 40 milligrams a day or lower is what's optimal. In fact, between 10 to 20 milligrams is very effective on a daily dose. So let's move on to our products, because we do want to talk about products that we've talked about, what glaucoma is, some of the risk factors, some of the traditional treatments that we offer in medicine, and then we moved on to cannabis, the different species, what CBD is, and some studies that show how CBD can be effective for some of the symptoms that those who have glaucoma suffer from. So here is a disclaimer. It's super important that you understand that we cannot make claims that if you have a loved one that has glaucoma, we can't make any claims that CBD, any of these products would cure any of those conditions like glaucoma. If you are pregnant, if you're nursing, if you're under a doctor's care, please engage your physician and let your physician know that you want to use CBD so that they understand that you are using a holistic option. And I call it just another tool in your toolbox that can address some of these symptoms. It's important that you know that not all CBD is made equally. I talked about at the beginning that there are CBD products found at the gas station, in the grocery store, at the health food store, at the smoke shops, you name it. You can find CBD almost anywhere. But not all CBD is made equally because, one, a lot of those products, you have no idea where they came from, right? There's no document of what's in it, if it's ever been tested. And it's very important that you understand all of our products here at Wakana come with a certificate of analysis. that we test our products through a third-party validation lab. We've partnered with Green Scientific. It's a lab that does our potency. It tests for mold, mildew, heavy metals, pesticides, and residual solvents to ensure that you're getting a product that's safe and a product that's effective. Now, our tinctures are products that you use by placing it under the tongue. We have two formulations. We have a power line that is a full spectrum CBD product that contains the legal limit of THC, which is 0.3% or less. We also have a broad spectrum product. It's called our Pure line. That's a line for those who have random drug screens at their job. So the Pure and the Power are two different tinctures depending on if you have random drug screens at your job. Now, when you use a tincture, it's important to hold it under the tongue, and before you swallow, you hold that tincture for at least a minute, if not more. That really improves the bioavailability of the CBD getting into the bloodstream. We also have a product that's water soluble. You know, maybe you're not one that wants to hold an oil underneath your tongue. We have a product that you can use in your water, your tea, your coffee, your smoothie, your food. It is our Power water soluble product. And then we have different potencies. We have a product that's 900 milligrams of CBD in a 15 ml bottle. We have products that are 300 milligrams of CBD in a 15 ml bottle. And then our Power Hempranium, which is 500 milligrams. So it really depends on the severity of the condition, and we could recommend the proper amount of potency to you. We also have edibles. Edibles are another way that you can get CBD into your body. We have amazing gummies, again, coming in our Power or our full spectrum CBD line, or our Pure, our broad spectrum CBD line, depending on if you have random drug screens. I absolutely love using tinctures and an edible in those who are starting out with CBD, who want to address inflammation, who want to address pain, who want to address anxiety, right? That allows for the CBD to have a steady state in the bloodstream all day and all night. Now, our smokables are another way to consume CBD. Smokables are able to work very quickly. The other methods can take from 15 to 20 minutes to get into the bloodstream with our tinctures, to up to 2 hours if you're using a gummy. Smokables take about 1 to 5 minutes before you start to feel an effect, because it can rapidly have that bioavailability because it is bypassing your GI tract. So we have smokable cartridges, we have pre-rolls, we even have a new cannabinoid in our smokable, as well as our edibles, our Delta 8. These are amazing products as well that can be used to address symptoms from glaucoma. Now, topicals are amazing products as well. They offer local relief. You would not put a topical on your eye. Absolutely not. Don't do that. But I am just bringing up our topicals in the event that person has discomfort or dis-ease in other parts of their body, their knee, their shoulder, their back, their neck, etc. So our topical products come in all power, meaning that if you have random drug screens, because it's a topical, it can be safely used for those who have random drug screens. We have our Power Screen Pain Cream, which is our #1 seller here at Wakana, #1, hands down. We have our Dr. Rita's Rub, which is a topical roller ball. It is in a liquid form. And then we have amazing body cream as well that can address those conditions or issues you may have with your skin. Our culinary products are another way to get CBD into the system. You can bake with our CBD Culinary Plus. You can use the vegan butter in your oatmeal. You can use our spices to spice up your favorite recipe. So again, I want to stress dosing recommendations for glaucoma. That study in 2006 found that CBD doses above 40 milligrams can actually increase the intraocular pressure. So you want to stay around 10 to 20 milligrams a day. So if you are using the tincture, let's say you want to use our Power Hempranium 3 drops twice a day, which I recommend, and you use a gummy at night, which I recommend, that puts you at 30 to 35 milligrams a day. That's a perfect dose for someone who has glaucoma. In fact, the Mayo Clinic did a recommendation study as well, and as you can see in this chart, they also recommend for glaucoma no more than 40 milligrams of CBD, no more than 40 milligrams of CBD. I'm gonna say it one more time, no more than 40 milligrams of CBD on a daily dose. So if you keep it around 20 to 40 milligrams, that is a great daily dose. Well, we cannot forget about food. Food can change the trajectory of so many chronic conditions that we see today, right? Every time we talk about food and every time we talk about improving conditions in our health, we end up with the same answer: fruits and vegetables. We can't get around it. Fruits and vegetables. So antioxidants and nitrates may reduce glaucoma risk and are found in what? Fruits and vegetables. They're not found in processed fried chicken. They're not found in lamb chops and beef. They're not found in hamburgers, but they are found in eating fruits and vegetables. So it's really important that if you want to reduce your risk of glaucoma, or maybe you have glaucoma, you've been diagnosed, you want to have a healthy diet with what? Fruits and vegetables, especially those that are rich in vitamin A, vitamin C, carotenes, and nitrates. These include green leafy vegetables, your carrots, your cruciate vegetables, your broccoli, your berries, your citrus fruits, and peaches. Exercise. If you have glaucoma, you want to stay away from doing any positions in yoga where you're on your head. So yes, you can do yoga, but it's not recommended that you do a headstand during yoga. You want to reduce that pressure. So as long as you're doing exercises which you're not standing on your head, you are good to go. So that's all for me tonight. So sorry that we had that little glitch with our Zoom ID. I want to thank you for attending. If you have questions, I'll take a couple of questions before our 8 o'clock business overview. You can always email me at ritamd@wakana.com. Again, that's ritamd@wakana.com. I'm going to take 1 or 2 questions because we've got to get ready in 10 minutes. Yeah, 10 minutes for our 8 o'clock call. If you have any questions, you can put it right there in the chat. And Erica Zachary said, I don't see your slides, but hopefully you were able to see my slides. I changed that at the end. If you have any questions, you can put it right there in the chat box. If not, whoever invited you on this call, please connect with them. Please get your additional, maybe you have some additional questions answered about products, get your products ordered so we can get them shipped out to you ASAP. At 8 o'clock, we're going to have a business overview. A business overview, we'll talk about more products, we'll talk about the opportunity here at Wakana, and we'll get you going as well. So if you have time, hop on at 8 o'clock. It's only going to be 30 minutes. I won't keep you long. Attention spans don't last past 20 or 30 minutes. So we'll get you in and out so that you can start your evening, or you can end your evening and get some rest. Any questions? I guess not. Wonderful. So thank you for attending. I'll see you in about 10 minutes. Have a good night. Be well, be safe, and we'll see you next Tuesday.